This episode is brought to you by Iron Aesthetics. They are an award-winning medical spa with 3 locations on the North Shore, including Linfield, Newburyport, and Salem, Mass. Their practice is women-owned, nurse practitioner-led since 2012. They offer the best technologies, services, and products to help people meet their goals. Schedule a consultation with their providers and let them get you started with a customized treatment plan. You can schedule via email at info@rnaesthetics.com or call them at 978-594-4356.
Welcome back to Scissors and Scrubs in this festive holiday season. Yeah. Jingle bell. So, we're going to give you a Christmas Scissors and Scrubs away, which means we're going to shit all your holidays with some really depressing stuff.
Make you question everything you're going to do.
Exactly. Yeah. We have all these holiday parties coming up. Mm-hmm. What do we do at the holiday parties?
Drink.
We drink.
We drink.
We drink. We drink a lot.
We
then
binge,
they try
you might
to do
say.
that dry January, and then you go back to drinking, and then the summer comes and you're drinking some more.
Yeah.
And, everything is good in moderation.
Everything.
But we had to discuss what happens when drinking is not moderate and you become an alcoholic.
Yes.
People think alcoholism is just a liver issue, but alcoholism literally affects
everything
from stem to stern on you. Everything. Absolutely everything. So we're going to cover that today.
Yep.
We just left a lovely retirement brunch for somebody who we've worked with we have not worked with him for 42 years, but he's retiring after 42 years.
Yes.
And I feel like I'm getting left behind.
I was saying that to one of the ladies that was there that's retired a long time ago. Not a long time, several years ago though. And I was like, everyone's leaving. I'm like everyone's leaving.
It's like you're in prison and they're all getting paroled and you know you got another 10 years on
we're
sentence.
the old ladies now. We're like the old people that what was it like then? I'm like, well, I'm not that old. Like, I don't know,
Right, but we're watching the people who worked the way we did leave.
Yes.
And you can't explain to the new kids what these people like because they have no idea.
No.
And I feel like I'm getting left behind. I hate it.
I know.
I
feel
wish
like
them all
someone's
the happiness.
grandmother though, like, oh, when
the
so-and-so
days.
was here, it was just so wonderful. And
things were so much better.
Yeah.
Or when we were just in one building and everybody knew each other.
Yeah, that was better.
I'm like, it's not the same.
No, it's not.
So I had a lovely alcoholic beverage for breakfast,
Yeah.
Nursing a little hangover from a Christmas party last night, which was fun.
Mm-hmm.
And I am going back to moderation because over 50 and alcohol do not mix very well.
No.
And it's not like you can bounce out of bed and recover and be like, I can go to work now.
No, it's like a 3-day
It's like
problem.
a 3-day problem.
Yeah.
It's a headache. It's my stomach's a mess. It's bad enough that I will say, I'm good. I don't want to do this anymore.
Yeah.
And I never thought those days would ever come, but I am there where I'm like, no, I'm good. Can't do this anymore. So, Sparkles, take it away.
Okay. So I got my information from uptodate.com and mayoclinic.org. And it's on alcohol abuse disorder, because that's what we call this now.
Yes, AD,
AAD. AD.
Yeah.
Yeah.
Mine was alcohol usage. It was different letters. I'm like, whatever.
Yeah,
You're an alcoholic.
we don't call it
I
alcoholism
love how we
anymore.
take all these stigmas. I don't care what you call a pig. It's a pig.
Yes.
You can put all these different names on it.
I know.
We're still going to say the same, have the same image.
So, alcohol abuse disorder is a pattern of alcohol use that involves problems with controlling your drinking, thinking about alcohol all the time, or using it even when it's causing problems. Life...
You see all the time.
Yeah, your life revolves around it.
Mm-hmm.
Alcohol abuse disorder also involves having to drink more to get the same effect, or having withdrawal symptoms when you suddenly stop or significantly decrease your usage. Unhealthy alcohol use means using alcohol in a way that puts your health or safety at risk or causes other problems. Binge drinking is also considered unhealthy use. It doesn't mean you're thinking about it all the time, but if you're binge
when you
drinking,
drink, you can't stop.
Yes. Binge drinking is described as 5 or more drinks within 2 hours for men and at least 4 drinks in 2 hours for women.
Wow.
Which doesn't seem that much.
No, I mean, well, in 2 hours?
4 drinks? That's not that
for a woman,
much.
but I mean, and the thing too is what they're considering drinks, because my brother had a friend that went to AA and he was like, I don't know, the guy's like, when you go to AA and they're talking drinks, they're talking.
Oh, I have down what it is.
What is it, 12 ounces?
Of beer.
Yeah. We're not drinking 12 ounces. You're drinking double that half
That's
the
what
time.
I'm saying. So 4 drinks isn't that much. That's what I'm saying. If you have 2 beers that are big,
Right.
that's technically your
Four
4 drinks.
Right. So
No.
it's just like, and he saw his friend. He's like, oh my God, I'm drinking like double that.
Yeah.
And he's like, maybe I'm an alcoholic.
So I have what's considered 1 drink. 12 ounces of beer, that's 5% alcohol. Because some beers now are like 9% alcohol. So that would be less
And
than
to give you an idea, I mean, I think what is 8 ounces is a cup.
Yeah.
So 12 ounces is a cup and a half of beer.
Right.
Most of your pints and shit are
More than that.
4 cups.
Right.
You know?
And that's only at 5% alcohol. Like I said, like a lot of these like
like a Bud Light.
breweries that
Yeah.
have beers are like 8,
8 and
9.
12,
Yeah,
yeah.
it's like crazy. 8 to 9 ounces of malt liquor, because malt liquor is usually about 7% alcohol. 5 ounces of wine, because wine is 12%.
So it's a half a cup.
Yeah.
It's a half a cup of wine. Who drinks a half a cup?
Right. That's what I'm saying when you think about it. If
Yeah.
you have 2 glasses of wine at a restaurant, you're having your 4 drinks within 2
in a
hours.
second.
Yeah. And 1.5%, 1.5 ounces of hard alcohol, because hard alcohol is usually 40%.
So 1.5 is a shot.
Right. And in a drink, that's usually all it is a shot. But so it's not a drink. You're probably drinking way more than what a drink actually is. If your drinking causes repeated significant distress and problems functioning in your life, you probably have alcohol abuse disorder, and early treatment is crucial. Don't let it get out of control. Signs and symptoms of alcohol abuse disorder. They can be mild, moderate, or severe. You're unable to limit the amount of alcohol you drink. Like, I'm just going to have 1, and then you end up having 10.
6, yeah.
Trying to cut down on what you drink, but being unsuccessful. Spending a significant amount of time drinking, getting alcohol, or recovering from using alcohol.
Yeah.
Craving alcohol. Failing to fulfill important obligations at work, school, or home because of your alcohol usage. Continuing to drink even though it is causing problems physically, socially, and financially.
Yeah.
Reducing social activities and hobbies to use alcohol. Like, you're not going to do the thing, I used to play softball, but I'm going to stay home and have a few
You want to
beers.
stay home all the time so you can drink.
Using alcohol in unsafe situations like while swimming or driving. Developing a tolerance. And experiencing withdrawal symptoms like nausea, sweating, and shaking when you don't drink, or drinking so you don't have those symptoms.
That if you don't, nothing else is your key.
Yeah,
that is your key. You get the shakes when you stop drinking.
Yeah. Or you're like, I got to have a drink so I don't do that.
Right.
Those are all signs and symptoms that you have alcohol abuse disorder. So I talked about withdrawal. What is withdrawal? It occurs when alcohol use is heavy and over a long period of time, and then is abruptly stopped or very greatly reduced. So if you drank a case every day and then you're like, I'm only going to have 1, you're going to have withdrawal.
Yep.
If you drink 12, if you drink 12 beers a day for a month, then stop cold turkey, you can and probably will go through withdrawal. It can happen a few hours after stopping or up to 4 to 5 days later.
I talk about them in DTs.
Okay. Signs and symptoms of withdrawal are sweating, tremors, sleep disturbance, nausea and vomiting, rapid heartbeat, hallucinations, agitation, anxiety, and seizures. People can die from withdrawal, so when stopping or drastically reducing how much you drink, it is best to consult a physician. My stepfather used to, he was an alcoholic, and he would be sober, and then he would go on a huge binge, and then he'd be like, I'm sick, I'm not gonna be around for a little bit. And he would stay like in his room, and he would have Gatorade and I think like saltines or something. And like literally that was it for a week. And he would just withdraw. Like he would withdraw himself. And I was like, he's going to die doing this. Cause like you'll go through DTs. Like you can die.
Yeah.
Like go see somebody that will tell you how to do it. They will help you do it. They will give you medicine to help you. But don't just do it on your own. You can die.
Things about alcoholism, I think that people don't realize. It's not just heavy drinking. They were women. Mm-hmm. They have to have 2 glasses of wine every day. Mm-hmm. Okay, well, if you've been doing that for 10 years, you go in the hospital, they don't give you that wine.
Right.
You're going to have withdrawal, and that's just a 1 or 2 glasses, but you have it every day. Single day.
Yeah. And then I have what is alcohol intoxication. So intoxication occurs when the amount of alcohol in your bloodstream increases. The higher the blood alcohol content, the more likely you are to experience bad side effects. It causes mood changes, inappropriate behavior, poor judgment, slurred speech, poor coordination, and problems with attention and memory. If you are extremely intoxicated, you can experience blackouts where you don't remember events. Very high blood alcohol can lead to coma, brain damage, and death.
And you hear that all the time. Spring break.
Yeah.
Over the kids. Anywhere like a bunch of, 18 to 24-year-olds are gathering. Somebody gets alcohol poisoning. Everybody from the 80s knows somebody got their stomach pumped from a party.
Yeah. And you can have an adverse reaction that can kill you or cause irreparable brain damage, and these are the the 5'2", 100-pound girl who's doing 15 shots in 2 hours. You're gonna be in a lot of trouble. Yep. Causes of alcohol abuse disorder: genetics, psychological disorders, and social and environmental factors all impact how you handle your alcohol use. Drinking too much over time can change the areas of your brain that experience pleasure, judgment, and behavioral control, which can result in drinking to restore good feelings or reduce negative feelings. So if you're drinking, it changes your brain. You have to drink to try to get those feelings back.
Right.
Or to not to feel depressed.
I'm drinking to forget. I'm drinking to, how many times I'm drinking to dull the pain.
Right.
You don't want to drink to dull the pain. Yeah. It's only going to make the pain worse.
Risk factors. Alcohol abuse disorder occurs most frequently in your 20s and 30s, but you can get it anytime. You can be a 70 and start it. Steady drinking over time. If you drink too much on a regular basis, or you're binge drinking on a like every Saturday you go out and just pound beers so you black out. If you start drinking at an early age, if you have a family history of it, if you have depression or other mental health problems, if you have a history of trauma, like you said, people drink to dull the pain and then they get hooked. Having bariatric surgery. We did an episode where we interviewed a friend who had bariatric surgery, and she became an alcoholic after. Alcohol is a thing that a lot of people who have bariatric surgery go to. Instead of the food, they start drinking.
You have an addiction to something, so you're substituting one for another.
And alcohol is one of the biggest ones they go to.
And part of the reason, too, is because it doesn't take much to get them drunk.
Right.
Now you've had it takes one glass of wine, you're going to feel like you had 8.
And social and cultural factors. You're influenced as when you're a kid, a teenager, by your parents. Are my parents shit-faced all the time? Oh, it's not a big deal. Your peers, if they're drinking all the time. Your role models, like if they'll, like if you're looking up to somebody, they go and do this and they go and do that. That influences if you're going to drink a lot. And for adults, your friends, like if your friends are going out every week, you tend to do the same thing as them. Oh yeah, I'll have another one. Or I know I do that. And like your husband, your wife, your partners, like if they're, I'm going to have a drink after work. Oh yeah. All right. I'll sit and have a drink with you. And then it becomes more than one.
I've noticed a couple where the husband has was a drinker. He drank a lot. And I see her do it now.
Yeah. But it's just because that's like their social, that's what you do.
Everything revolves around it. Yeah.
Yep. Complications from alcohol abuse disorder. Alcohol is a central nervous system depressant. Too much causes drowsiness, loss of control of your actions, slurred speech, loss of muscle coordination, coma, and possibly death. It lowers your inhibitions, which can lead to poor choices in unsafe situations like motor vehicle accidents, drownings, relationship problems,
risky sexual behavior,
poor performance at school and work, increased likelihood of committing violent crimes or being the victim of a violent crime, legal and financial problems with other substances. You get drunk, someone offers you, oh, look, I got some of this here, I got some of that, and your inhibitions are gone. Engaging in risky sex or being sexually abused or a victim of date rape, and increased risk of attempted or completed suicide.
Oof.
The health complications of alcohol abuse disorder, there are a million. I briefly go over these. Digestive problems. You get gastritis, which is an inflammation of your stomach. Ulcers, pancreatitis, decreased absorption of vitamin B and other nutrients, which leads to a slew of other problems. Heart problems. You get hypertension. It increases your risk of an enlarged heart failure, and stroke. One binge can cause atrial fibrillation.
Wow.
It causes like a lot of problems with your heart.
You're really pouring toxic stuff in.
Yeah.
Like there was, I'm watching stupid TikToks, and there's one guy, he debunks a lot of like health nuts will get on and be like, never eat this and never do this. And one guy got on and he's like, I never drink alcohol because even one drink is too bad for you. And the guy's like, actually, he is absolutely correct. Yeah. If you want to avoid a million health issues, never drink alcohol. Yeah. But nobody's going to do that.
Right. if you're a diabetic, there's diabetes complications. Alcohol affects the release of glucose from your liver and can increase the risk of hypoglycemia.
And it's loaded with sugar.
Yeah. This is dangerous, especially if you're already taking insulin or you're on a diabetic medication and then you have some drinks and then it reduces, you're already causing hypoglycemia with the medicine and then you're drinking on top of it, your sugars can drop wicked low or your sugars can go sky high if you're having mixed drinks and all this. Men have problems with erectile dysfunction and women get interruption of their periods if they're, have alcohol abuse disorder. It causes eye problems because of the vitamin B1 deficiency, which is thiamine. You can have nystagmus, which is rapid eye movements, and weakness and paralysis of your eyes. So the not absorbing vitamin B causes a ton of problems. Yeah. You can have bone damage. Alcohol can interfere with bone growth, which can cause osteoporosis, which increases your risk for fractures. And when you're drunk and you fall, you're going to break something more. It can also damage bone marrow, which produces blood cells, which can lead to low platelet count, resulting in excessive bruising and bleeding. So again, you fall, you hit your head, you're drunk, you drink all the time, you're going to bleed right into your brain. It causes a weakened immune system. There's a ton of medication interactions. It can either weaken your medication or it can cause it to work more. So the interactions with medication and alcohol are severe, especially ones that cause drowsiness. It's an alcohol abuse disorder causes an increased risk of cancer, especially for mouth, throat, liver, esophageal, colon, and breast cancers. They are highly linked.
Breast cancers are interesting. I get everything else because it's literally everything the alcohol touches.
Yes, breast cancer. They're highly linked to long-term excessive use of alcohol, and breast cancer is linked to you don't even have to use it that long, and it's linked to. Breast cancer has a very strong link to drinking. It's weird.
That's really weird.
Yeah. I know. Everything else, you're like, okay, got it. It's going through my mouth, going down my esophagus, going into my stomach.
Everything your liver would, your
it's
body
through your
would
digestive system.
Yeah. The breast still makes sense.
Yeah. But that has a very strong, it's weird.
Interesting. Yeah. That's very weird.
It causes neurological complications, numbness in pain in your hands and feet. It causes disordered thinking. It causes dementia, and it causes short-term memory loss. It also causes birth defects. Alcohol use during pregnancy may cause miscarriage, and it may also cause, which this is now a new name, fetal alcohol spectrum disorders. We used to call it fetal alcohol syndrome, which means the child is born with physical and developmental disorders that last their whole lives. It's not like they're born
and a kid with fetal alcohol, you know them the moment
they have a
see
look.
Them.
Yeah. I have a cousin with fetal alcohol, and he looks like he has fetal alcohol.
When I was in nursing school, my nursing instructor for maternity, I loved her. She was hysterical. And she was saying, this baby's born. She goes, and it's fetal alcohol. There was no doubt about it. It was fetal alcohol. She goes, we get in the 51A because we're going to write this up because this is ridiculous. This is fetal alcohol. She goes, this is the day when they had the maternity wards and the people could come in and look at the babies.
Yeah.
She goes, and the father came in. She's like, I tore up the paperwork. Looked just like the father.
Oh, God. Oh, my God. She saw her.
She's like, thank God he came in because it looked exactly like the father who looked like he had fetal alcohol. I started laughing. I thought that was the greatest thing.
That is funny.
So
they have a very specific look. It causes liver disease. Heavy drinking causes increased fat in the liver, which is hepatic steatosis, and inflammation, which is alcoholic hepatitis. And over time, it can cause irreversible scarring of the liver tissue, which is cirrhosis. Patients with alcohol-associated cirrhosis may undergo liver transplantation if they have severe disease that warrants it. So just because you have alcoholic cirrhosis doesn't mean
you're going to need a liver.
You're going to need a liver. But if you have complications from the cirrhosis, like portal hypertension or compromised liver function, then you can get a liver transplant. Abstinence from alcohol use is expected for patients on the transplant list. Some programs need you to be 6-month alcohol free before putting you on the list. But others feel this patient's so sick, they're going to die before the 6 months, they will put you on the list if they feel you're not well enough. It depends on the program. They all have different rules.
And these people, when that liver finally says, I'm done,
it's done.
They are so sick.
Yeah.
They are so sick.
So some of them are like, no, forget it. They're not going to last 6 months to get sober. So some centers monitor patients waiting for transplant for their alcohol use, and some require the patients to be in an alcohol treatment program like AA while they're on the list. 21% of liver transplants in the U.S. in 2015 were for alcohol-associated cirrhosis. 1 in 5 year survival rates and graft survival rates, meaning like the liver that was transplanted, after transplantation for these patients are similar to patients receiving liver transplants for other reasons. So they have the same outcomes. 1 to 5 years out. However, 10-year patient and graft survival rates are lower for patients that had alcohol-associated cirrhosis than other patients.
Interesting. Well, because you know what? It's damaged all the other stuff.
That's the thing. They've damaged other parts of their body, so they're not doing as well.
Right.
Relapse after transplant happens in 10 to 30% of the patients and increases the risk of graft rejection, loss, and recurrent disease and survival.
That's high. Yeah. I can't imagine going through all that shit and then picking up a drink. Like talk about a disease.
That's the thing. That's
really an addiction. If you're willing to,
if you just
shut your organs down, you got a new one, you're doing it again.
Remember, drinking causes a lower immunity. And post-transplant patients are on anti-rejection meds forever, which lowers your immunity, so they're like super susceptible to infection.
Everything.
A poor support network, a family history of alcohol abuse, and not being abstinent from alcohol for 6 months before transplantation are predictors for post-transplantation
Makes
relapse.
sense.
Yep. It is encouraged for post-transplant patients to participate in an alcohol treatment program, and some programs actually monitor the post-transplant patients for alcohol abuse as well. But they highly suggest you get sober before getting on the list. It just helps you after.
Yeah.
Prevention for alcohol abuse disorder. Early intervention is huge. If you have a teenager, you have to be alert to signs and symptoms that might indicate the problem with alcohol, like loss of interest in activities, loss of interest in their appearance, red eyes, slurred speech, memory lapses, problems with coordination, difficulty with friends or hanging out with a totally new crowd, problems in school, mood changes and defensive behavior, which are hard to spot in a teenager because that's what they have all the time.
I mean, you see some people when they drink, like, again, to go back to the Murdoch case, because I'm obsessed with the fucking Murdoch murders. That kid Paul, when he drank, it was like Jekyll and Hyde.
Right.
He was a completely different, aggressive, angry, like person.
Right. And I think with boys, especially teenage boys, they have that in them right? They have all this suppressed anger, so then you're inhibiting.
Right. I mean, you've seen people I think if you're that person where when you drink, you become a horrible person on the other, and you can't control it, you should probably not drink. Right. At 100%.
All. But I think teenage boys have that in them anyways, and then you're lowering your inhibitions with the alcohol, and then just, they're just letting it all out. Not that that's okay, but you have to watch for this.
But to see such a drastic personality, I mean, I had a girlfriend who loved her when she wasn't drinking. The moment she drank, I was like, who are you? I stopped hanging out with her because she was horrible when she drank.
Yeah. But teenagers, it is they just have mood changes anyways. Yeah. One day they're so happy, and then an hour later you're like, what happened? I don't even understand. To help prevent teen alcohol use, set a good example. Mm-hmm. Talk openly and be involved in their lives. Learn about them. Talk to them. Mm-hmm. See what they're doing. Go to their things. Show up for them, and discuss expectations and consequences. Some people are okay with their kids, are okay giving their kids alcohol, which is crazy. Some people, are like, I know you're going to drink. I expect you not to drive. I expect you to come home. I expect you to be able to speak to me. Your kids are going to drink.
Keep your shit together.
Get it together. And these are the consequences if you do this. Or I don't want you to drink at all, and these are the consequences. But be clear and pay attention.
Right.
Many people with an alcohol abuse problem don't recognize they have one. If you are drinking too much, binge drinking. If your drinking is causing problems at home, work, in relationships. If you think about drinking or plan around drinking. If loved ones are expressing concern about your drinking, you should seek help. It's hard to see that you have a problem.
I think many, many people don't see they're alcoholics.
No.
Many people.
Because you can come up with a lot of excuses.
Right. And some of them are not your classic alcoholics. Right. They just come home and they have 2 or 3 drinks every night. And they're like, but I'm perfectly fine.
Mm-hmm. Well, but then you're at work going, I'm going to go home.
And I'm going to have
that drink.
Yep.
And then I'm going to have another one. And then maybe a third one. Right. Like you're thinking of, if you're thinking
planning
about
your
it,
night around
right.
it. Like,
then it's a problem.
It touches your lips and you're like, oh, this is the best,
Talk to your PCP. Get a counselor. Get a psychologist. Go to AA. See, maybe this will work for me.
Yeah.
Do something about it. And if you are concerned about a loved one's drinking, reach out to a professional for guidance on how to approach them so it can be effective. Don't just be like, hey, you got to knock it off. Like, talk to somebody, come up with like a plan to help them. They might not listen to it at first, but if you can approach them in a way that they might listen more, it'll be more helpful.
That are just
not going to listen.
Not going to listen no matter what.
Yep.
So I'm probably going to cover a little of also what Laura talked about. I'm going to talk some of the complications a little more in depth. My information came from Mayo.com and Johns Hopkins Medical, #1 hospital in the country.
Yep.
I'm going to get a little more into liver cirrhosis. We're going to call it fatty liver because you said the word and I never can pronounce it, which is the most common form of alcohol liver-induced problem. It's the buildup, like she said, of fat inside the liver causing enlarged liver. It can happen to anyone who drinks heavy. Did that what I wrote? Yeah, drinks a lot. That's what I wrote. So it's heavy. That's like the worst form of it. Then you can get acute hepatitis, which is alcohol-associated hepatitis, is an inflammation of the liver with death to the liver cells and permanent scarring. So when you do a transplant on somebody who has cirrhosis of the liver, the liver, we've talked about this in, I think, our transplant episode. The liver is like I know it sounds weird. It's a beautiful organ. But it really all right? It really is.
So smooth.
It's smooth and shiny and pink, and it's enormous. Like, you cannot believe how big your liver is. It's fucking enormous.
It takes up the whole top of your abdomen.
It is
right under your
enormous.
Whole pot.
Right. From in front to back, it's thick. Like, it's one of your bigger organs. When somebody comes in with alcoholic cirrhosis, let alone how they look physically everywhere else, the liver is black. It's covered in like cysts.
It's so lumpy. And
it's lumpy. It's shrunken up. It's shrunken half the size. It's hard. It's if people who drink alcohol could see what a liver looked like, it's horrific how bad it can be. And it can happen quickly to somebody with that. So that's the liver set. Like, it's black. Part of it will be black from the death. It's disgusting.
It's amazing how small. Sometimes it comes out, I'm like, that's the littlest.
Yeah.
Liver. And sometimes it comes out and you can smell alcohol.
Yes.
You can smell the alcohol. I'm like, and I know they didn't drink today. Like, they weren't drinking yesterday.
I remember doing a trauma, decades ago, and he was drunk driving. The sponges coming out of his body reeked about. It was disgusting because the smell of blood and alcohol together is not a good smell. So the actual cirrhosis, which is I can't read my own. I was in a hurry yesterday. So it's the destruction of the normal liver tissue. Now you've gone beyond like liver death cells. It is scar tissue has replaced healthy liver tissue, and it can cause the liver to stop working altogether, which is when you're going to need a liver transplant. Both of these are linked to long-term unhealthy alcohol abuse, which Laura covered as being 5 or more drinks a day for men, 4 more, and weekly. Like, I think you have to look at your behavior. If you can't go weeks without alcohol and then just have one and keep going more weeks, then you have a problem. Right. Like, you have to be able to, I say now, like, 2 drink limit. That's it. I go out, I have 2 drinks, I'm done. Yeah. Because anything over 2 drinks, I'm going to feel awful. Right. And I don't want to get that look to my face and the belly, and we'll talk about all that as well. So signs and symptoms of a fatty liver, often for people, they have no symptoms at all. You might have upper abdominal discomfort on the right side of your body where your liver is, tenderness, weakness, weight loss. Anytime you're getting upper abdominal pain over your liver, you might want to get that checked. Yeah. That could be a problem. So signs and symptoms for acute hepatitis or cirrhosis are fever, weakness, abdominal pain or discomfort, nausea, vomiting, appetite loss, poor nutrition, weight loss, jaundice, portal hypertension. And this is going to be related. We're going to talk about esophageal varices, which is directly related to portal hypertension, which is the blood flow to the liver has decreased because of all the scarring and everything, and it forms the vessels to create new pathways around the blockages to the liver. The problem is the portal vessels carry massive amounts of blood, and the little pathways they make can't handle the amount of blood they take, and they get really enlarged. You can have an enlarged spleen, GI bleeds, belly ascites. So if you look at a classic alcoholic, they've got they look like the people on the UNICEF commercials. They got little tiny legs, little tiny arms, and gigantic bellies. Yep. And like, you can look at, like, Lauren, I can look and be like, oh, they got the alcohol body. They got the alcoholic face. You can just see them a mile away. Yeah. They can have increased infections, kidney failure, confusion. Treatment of this, stop drinking. Yep. All of these, the treatment's going to be stop drinking. So the portal hypertension causes esophageal varices. This is another major complication of being an alcoholic, which are these enlarged veins that go around the esophagus. And these varices, they can leak or they can rupture.
Yeah.
And they leak or rupture into your throat, into your esophagus, or into your colon or your small intestines. Signs and symptoms of this are vomiting large amounts of blood. When I say you are vomiting large amounts of blood, you are hemorrhaging through your mouth.
It's awful.
And recently we had somebody come in. I did his esophageal varices on a Friday night, and I did his liver transplant on Monday because that's how bad he had gotten. They have the Blakemore tube, which if you have never seen a Blakemore tube actually on somebody, now a lot of our people get flown in from other hospitals. So this person had ruptured their varices at an outside hospital, and they were coming in for what they call a TIPS procedure, where they go in with x-ray and stuff, and they try to clot these varices off to keep them from bleeding to death. And they put this balloon down their esophagus, which is a big, long balloon, and they blow it up as wide as it can go, and then they put a weight on so the tube is down your throat, it comes out through your mouth, it's hooked onto like a fucking hockey face mask. You look like Hannibal Lecter, and then there's a weight on it to keep the pressure on those, or you're going to bleed to death. If they rupture these in the wrong place, they bleed to death. It is a awful procedure, and they come in and they are covered all over their face and blood everywhere. And with that kind of blood comes the black tarry stools, also known as melena.
There is nothing like the smell of melena.
Nothing like the smell of melena. You can smell that three doors down. It's disgusting.
And you know it immediately. Oh, there's melena somewhere.
And that's from the leaking of the vessels, and they're swallowing the blood and swallowing the blood and swallowing the blood. You can have lightheadedness due to the loss of blood.
Yeah.
The varices are caused by the cirrhosis, blood clots, and there is a parasitic infection that we talk about. Remember skizzy?
Oh, yeah.
That causes esophageal varices because they block up all the vessels.
Yeah.
And it
so
causes,
they have to get new ones.
The major risk is bleeding. If you have had one bleeding episode of your varices, your risk is severely increased of you having a second. If you've survived the first one. Prevention, stop drinking. Eat healthy. Maintain a healthy weight. Be careful with household cleaners because they can irritate it. The chemicals, if you're smelling them and stuff, they can irritate it. Reduce your behaviors that would lead. So stop drinking. Really, your body has a great way of letting you know shit's not working right. And you really need to listen to it, because when it decides to stop, it stops. I mean, we one Christmas season had 3 30-somethings come in, and one of them had been working in like a kitchen, and he got like diarrhea, and his liver had shut down. Like, boom. He didn't even know it was coming. And he died. Yeah. I couldn't believe it. I'm like, how bad of an alcoholic do you have to be to die from it at 33? Like, that's so young. It was awful.
Yeah.
So another complication of alcoholism is Wernicke-Korsakoff syndrome. This is 2 separate syndromes or separate illnesses that can combine together at the end of one and become Wernicke-Korsakoff. So Wernicke-Korsakoff syndrome, WK,
much easier to say.
is associated with but not exclusively linked to severe alcoholism. It's estimated to be underdiagnosed in about 80% of patients, and I believe that because they just think, oh, it's dementia. It's Alzheimer's, it's dementia. WK involves 2 different brain disorders that often occur together. It's caused by alcohol abuse combined with the vitamin B1 thiamine deficiency. So when you see alcoholics come into the ER, they get what they call the banana bag. I remember this being on the nursing boards. Yeah. And a banana bag is vitamin B. That's the first thing they're going to give them because it really starts significantly reducing a lot of these symptoms, especially if they're going to start withdrawing on them. They'll start giving them the vitamin B1. Alcoholics have poor nutrition because they drink their meals. Yeah. If you watch an alcoholic, they're going to drink 3 or 4 drinks and they'll pick at their dinner because they're full on the booze. And that's where you get all these malnourished looks to them. Poor nutrition decreases the ability of the gut to absorb thiamine. So if your gut's not working right, you're not taking in the vitamin B from the food, and it increases your risk of getting WK. WK syndrome affects different regions of the brain, mainly the hypothalamus, the hippocampus, which I forgot that even existed in the brain. Did I say the hypothalamus? Yeah. The thalamus, the hypothalamus, the hippocampus, and the cerebellum. These areas are responsible for vision impairment, vision, movement, language, sleep, memory, and motivation.
Mm-hmm.
Alcoholics apparently are not very motivated because everything kicks is their motivation. So the first symptoms are really of Wernicke's, which are confusion, lack of energy, hypothermia, low blood pressure, possibly a coma, lack of muscle coordination. It affects posture and balance, and it can lead, what did I write? Tremors. It can lead to tremors. It can cause vision problems like Laura talked about, nystagmus, double vision, cross-eyed, eye drooping. The eye issues and the muscle issues can resolve once they get thiamine. So if they start seeing these issues and they go right to the ER, they'll give them the thiamine and you can resolve these issues. Yeah. The other symptoms may be very slow or not completely resolve at all. Mm-hmm. Without treatment, Wernicke's will progress to Korsakoff psychosis. Excuse me. Symptoms of Korsakoff psychosis. This specific disease fascinated me in nursing school, and I think it was because I think there's a lot of dementia people out there that have this, and people didn't know. I was fascinated by this. So severe, irreversible memory impairments, like you can't form new memories, you can't recall old memories. And you can see why, when you hear the symptom, you can see why it's often misdiagnosed. You make up stories or you remember things completely incorrect. You hallucinate, repetitive speech and actions, problems with decision-making, lack of motivation, and emotional empathy. The diagnosis is usually 3 symptoms, though if you see an MRI, you can actually see the damage they've done in the brain. Well. So both Wernicke and Korsakoff are treated with vitamin B1. Wernicke's can resolve, but if left untreated, it goes into Korsakoff syndrome, which can lead to permanent damage. You might not come back from that. So you've been diagnosed with liver cirrhosis, you've been diagnosed with Wernicke's, and you're like, I'm done. I stop drinking. But you've been drinking a handle of vodka a day. We can't just stop drinking, because if you just stop drinking, as she said, you're going to get the DTs, also known as the delirium tremors. This came out of the Cleveland Clinic. Delirium tremors are the most severe form of alcohol withdrawal, and it can be life-threatening. It happens when a severe alcoholic stops drinking. This is why you're going to get the DTs. Alcohol depresses your central nervous system. So as more your central nervous system gets depressed, it's releasing chemicals to bring it back up, because your central nervous system is your breathing. It's everything. Your emotion. It's everything. So it has to compensate. So it's constantly giving you more of what you need to keep it active. And your body takes that as its new normal level. When you stop drinking, you still have these huge high amounts of chemicals keeping your CNS overly active, and it can't handle it. Now your body's going out of control because the CNS has not been depressed. So I wrote all that down. I just explained it to you. So the symptoms, you're going to start, which the most common are the handshakes. And you'll see these people, you're like, hey there, shaky, shaky. It's especially in the hands. They'll have confusion, delirium specific to alcohol withdrawal. They'll have agitation or anxiety, which will lead to combative or aggressive behaviors. They can have psychosis symptoms like hallucinations, sensory disruptions and disorientation, heavy sweating. And then the seizures, these can be very dangerous and deadly if left unchecked. They turn into status epilepticus. That's when your seizures are going on for very long times, or it's one after the other, after the other, after the other. And if you're seizing like that, you can't live. Like it's not compatible with life. And it will lead to death. They will have high temps, headaches, nausea, vomiting, fast heart rates. The initial symptoms will appear, like she said, 1 to 3 days after the last drink. The most severe symptoms are 4 to 5 days after the last drink. Your risk factors of DTs are you already have a history of DTs. You have multiple tries to stop drinking and it's not working. You are a heavy alcohol drinker. You are older. You don't see DTs in people who are in their 30s. Usually you're going to see them in people in their 50s and 60s, established alcoholics.
Your
their
CNS
body
is severely depressed.
your body is 100%. So the treatment of this is you have to slow down the CNS. So they're going to give you benzodiazepines. If you are really, really bad, they're going to give you general anesthesia to calm everything down. They're given IVs where they're getting many vitamins, not just B1, many minerals. And if you work if you wish to quit drinking after years of abuse, you have to do it under a doctor's prescription. Like even in the medical floors, the hospitals, they'll have beer and they'll have alcohol up there because you have these alcoholics come in. You've got the little 80-year-old lady who doesn't tell anybody that she drinks alone by herself, and then she starts the fucking DTs. Right. So they give her a beer a day to keep her going until she's out of the hospital. You know, like that. They've countless things like that.
You call the pharmacy and they give you a beer.
A lot of older women are closet drinkers.
Yeah.
Nobody knows. They're stashing a bottle of scotch. And they have a scotch and water, a couple every night.
And like if you're a little forgetful or a little, your balance is off. Well, you're 80. So like people just assume it's because you're 80, you know. They don't know you're drinking.
Yeah.
And we had a family member that was in the hospital for a while, and they're like, oh, they gave me Librium. And I'm like, oh. Well, that's because I drink, huh? And I'm like, yeah. Because they will give you...
Ding, 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 ding.
There's lithium and there's Librium. And Librium, booze. The B means booze. Yeah. So if someone's on Librium, it's usually not... It's used to treat someone who's in the hospital that is a drinker. They will give them Librium.
Right. To keep them from going into the
seizures
DTs and stuff. DTs are no joke. No. People joke about it. Oh, he's got the shakes. It is no joke. No. That's
your body is having a very hard
That's
time.
a very sad symptom that your body is that addicted to alcohol. Like I find any addicts, to watch them withdrawing and seeing their body go through that, it bothers me a lot. And it bothers me that people get there. And I understand there's many causes why people drink and do drugs, and they're all, they're self-medicating, whatever it is. It bothers me.
Yeah.
To see people so dependent on something like that. You watch the addicts at Mass and Cass, and they're like bent over in half, sleeping on the sidewalk, standing up. I'm like, how did you get there?
Right.
How did you get there?
Yeah, it's sad.
So Merry Christmas.
Merry Christmas.
Happy holidays. Happy Hanukkah, Kwanzaa, whatever you celebrate.
Don't binge drink. Just maybe one
moderation.
glass.
Just moderation.
One
Enough
glass
to get
eggnog.
you, having a little fun story and then call it a day. We don't want any risky behaviors during the holidays.
No.
My daughter's a peanut, and they're in high school. They're going to drink. And I don't want them to never touch it and get to college and go hog wild.
Right.
But she's a peanut. Like, you can't drink what anybody else is drinking because you'll be incapacitated in about 5 seconds. Yeah. I'm like, hold one all night. Nobody's going to know.
That's what I used to say to my kids is, like, if you're at a party or something and, everyone's peer pressure's a thing, and everyone, I'm like, get a can. Don't get a glass of anything. Get a can.
So they can.
Because you know what's in the can. And then you can hold that all night.
No, it's my 10th. Nobody's going to know.
No one knows. No one, because they've already probably had 10 themselves. So no one knows. If you feel that pressured, get a can. Do not get a cup. And just, you can stay with that one can all night. But these kids,
Well, all of us have that friend that you don't want to go out with anymore because they're sloppy drunk, who's wetting themselves. I don't have the patience for that shit anymore. I have less patience for it from somebody in their 40s and 50s. Like,
I know.
I can't stand sloppy drunks this age. It's like, I'm like, get your shit together. Come on. You're too old for this. I have no patience for it. Like I said, I know it's a problem, but on my end, when I see it, I don't like it. I don't like it. I never think it's funny at this age.
No. Well, I also think it depends on, like, how you grew up, how I grew up. Like, you have people and it just affects how you see it.
Yeah.
But
I find sometimes when you're have alcoholism in the family, you have less patience for it, and you tend to be a little more hyper sensitive to watching, like, oh, that person's been drinking all night. Yeah. So, all right, listen, enjoy the holiday season.
But don't enjoy too much.
Don't be drinking and driving. If you feel...
There's no excuse anymore. No. You can literally go on your phone that's in your hand anyways, get a car, and you're home in 10 minutes safe and no one's hurt. There is no excuse.
And, if you've been imbibing a lot all year and you see it's dry January coming, consult your doctor before you decide to just go cold turkey.
Yes.
All right.
Tell them honestly how much you drink. And they're not judging you, but they're going to help you be like, yes, you can do that. Or, hey, how about we go down to, 2 a day and then 1 a day and then do it.
And, if you think you need AA, it's not just a bunch of old vet alcoholics. You'll be surprised the people you will run into in AA. Yep. It's an unbelievable program. It has helped lots and lots of people. Mm-hmm. There's no shame in it, nothing wrong with it.
There shouldn't be any shame in it because you're doing something to improve yourself.
Yep. Yeah. And maybe you might be able to give somebody a story that might help them too.
Right.
So enjoy. Hope everybody gets what they want and everybody is safe.
Happy holidays.
Happy holidays.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.